Very soon, billboards will appear reminding every mother and father what they know but don't like to admit out loud. Parenting can be overwhelming. Welcome back. A new initiative, Strengthening Families, is designed to bring a new child abuse and neglect prevention approach to the 45211 zip code, Westwood and Cheviot. Designed by 4C for Children, Centerpoint Health, and the Children's Home of Cincinnati, and funded by the Hamilton County Family and Children First Council, the program will work with the staffs of child care centers and family child care providers to help them work with parents to prevent child abuse and neglect. To discuss the initiative, I am joined this morning by Carolyn Brinkman, who is the project manager for Strengthening Children at 4C for Children, which is the largest provider of training and technical assistance for early childhood caregivers and teachers for 23 counties in Southwest Ohio, Miami Valley, and Northern Kentucky. And Patty Eber, the executive director of the Hamilton County Family and Children First Council, which empowers families to shape community resources to meet the needs and to support diverse communities as they maintain responsibility for their children. Boy, that was a lot. I wasn't sure that people would really know about your two agencies, so I wanted to get that straight, and I should have read it better. Okay, thank you. Welcome to Newsmakers.
Thanks.
Patty, let's start out. This program, which people are going to start seeing these billboards, and if you have children in child care, you're going to see handouts, which we'll talk about in a minute. How did this get started?
Well, the Family and Children First Council, we were the recipient of the Hamilton County Family and Children First Council. We're the recipient of a grant from the Ohio Children's Trust Fund, which is a state agency that's designated to do prevention for child abuse and neglect. And we took this over about a year ago, and it was a relatively small amount of money for a program like this, which was $275,000 for the whole county. And we had a committee, we had a prevention committee, and we decided that rather than try and spread this among very small programs throughout a county the size of Hamilton County, that it would be better off to look for some kind of a program that we could do in a concentrated area that had a fairly high level of need, and we could try a new approach that was cost efficient and not very expensive, and that had some evidence-based kinds of successes behind it, and see if over a period of a couple of years we could impact the numbers. So we looked around and we did a lot of research and found this model called Strengthening Families, and decided to pair that. We put out a request for proposals for agencies to apply to pair that Strengthening Families model with a campaign for a media campaign concentrated in that area, and to work with a coalition of community leaders to see if we could have an impact if we did a very concentrated program in a small area. And we picked Westwood because when we looked at the statistics, Westwood, at least in 2007, which was the most recent statistics we could find, had the second highest rate of substantiated abuse and neglect statistics in Hamilton County. So that was one big factor. Number two, they were pretty low in resources as compared with Price Hill, which is number one, which has a lot of community agencies working in it. And they had a very large 0 to 5 population, and that's the age group we were targeting. Okay. So we issued an RFP, and 4C and this Consortium for Young Children received the allocation from us, and we worked with them, and Carolyn's the director, and they've done a fabulous job of getting this off the ground. I mean, really fabulous.
Carolyn, if I understand right, you live in the 45211.
Yes, born, bred, and raised.
So
yes.
this is targeting an area you know well.
Yes.
And how is it that 4C is going to work with and implement this plan? I mean, you work with these child care centers. How is it that this is actually going to work?
And we're actually just finished up year one of the initiative, so we're actually entering year two. In year one, a lot of our work was with the early child care centers and with family child care providers. So we went about recruiting from the 45211 area those child care centers and family child care providers who wanted to be involved in the initiative. And during year one, what we've done with them is really talk to them about protective factors. Strengthening Families supports 5 protective factors and believes that if those things are in place for families, what you do is strengthen families, build the confidence of parents, and we'll see child abuse and neglect decrease. The protective factors are really there for all families, so it's not about just families who are struggling or families who have had incidences of child abuse and neglect occur. It's really for all families. So we started working with early child care centers and the providers to look at understanding these 5 protective factors, what they mean, how they can make families better, how they can strengthen families as well as strengthen the community, and we've gone about working with them to start building those into their programs.
When you say 5 protective factors,
correct.
Is this there's all these wonderful sheets with these great graphics. I think we have one of them is a tip sheet.
Right.
And let's take a look. We've got a little bit of a image of a part of that. I couldn't get the whole thing on, but is that part of what you're talking about when you say these 5 protective factors?
Yes, 4 of the protective factors really focus on parenting.
I love the headline. Parents aren't born with all the answers.
Imagine that.
Whew, what you believe you are when you're about to be a parent.
Right.
Only after you're a parent do you know that. Okay,
right.
Go ahead.
Yes, we've developed actually 4 parenting cards that we'll be distributing throughout the area. So people will see posters and billboards as well as these parent cards available to parents. And they're really basic parenting principles, but they focus on teaching parents some alternative strategies, on working with their children, understanding child development better, which is all about parents aren't born with all the answers. Sometimes you need to slow down and get some additional information and learn what to expect from a 2-year-old, what to expect from a 4-year-old, and then how to work with your child in those time frames.
So is the theory here that the people who are coming in touch with the parents are the people who are taking care of those children in the various child care settings, early childhood education settings, and therefore they're the best position to have influence not only in the children but also the parents? Is that sort of the approach here?
Definitely. The reason that Strengthening Families focuses on early child care centers is we know that's a place where parents come. Parents come to drop off their children, and parents come to pick up their children. They often also hear from staff different things that have gone on with their child during the day, and often are looking for resources or support. And so very much so, we want to equip those child care centers and those early child care providers with some information and things that they can do differently. The other thing about Strengthening Families, though, it's very different about how you engage parents. The whole sense of how you really work with a parent, understand what the parent wants for their child, really work with that family system, help connect parents to other parents. It's really about getting to know the parent and the family from their perspective and working from their perspective, which is very different. A lot of times as professionals, we think we have all the answers, just like
the parents do.
Just like the parents do. And sometimes we have to recognize we have to know where they're coming from first and work from their shoes and come forward. And so it's really about getting staff sometimes too to take a step back and ask parents some questions and get to know what's important to the parent and start working with the parent in a different way.
Patty, the Families and Children's Council, first and whatever, is been at this sort of thing for a long time in terms of trying to prevent abuse and whatever. Is this really a fresh approach? Is this? It sounds very.
No, it's very.
It sounds very positive. It's not preventative. It's preventative, but it's not negative. It's really about positive actions on everybody's part.
Right, and again, part of the reason we selected this committee when we were looking at something that was going to be more innovative, and one of the things we liked about this is that, first of all, we're the first ones in the country that we know of to actually select just one community to do this in. Other places have done this through the whole state. But I'm really curious to see how this is going to impact when we concentrate so much in one community. And the idea that it's not, just working with the very at-risk families. This really is a very strength-based approach. But I'm going to be interested when we concentrate it so much if we can have some real impact.
So,
I hope anyway.
Visually, with these billboards, it's not just the parents and teachers in these centers, but everybody in the community. There will be a heightening awareness of this, and anybody can anybody can take advantage of these resources, right?
Yes. We've actually did a survey of 45211 back in December and got a really good read from parents from across the community, parents of high schoolers, preschoolers, toddlers, wherever they fell, and really got a sense of what they thought child abuse and neglect was about and what they wanted in their community. So part of the program that we've designed has been in response to that survey. We also have a parent advisory group that is set up of parents of 45211 across all ethnicity, across socioeconomic, again, across all child ages, and they were very much instrumental in helping us with these visuals. They really told us what they thought parents would respond to, what they really felt like as a parent. If they saw that, they'd go, yes, that's me. And we wanted to speak to all parents.
Yeah. Really great visuals, really great handouts. And final question, we're just about out of time, but you've been working, as you say, how many with child care centers, how many settings are you now really got on board and working with at this stage?
We have 9 child care centers. We have 15 family child care providers.
Wow.
And we've already contacted 3 of the elementary schools who want to work with us as well with their younger children in the schools.
And do you think there are more family child care providers out there in that area?
There are definitely more family child care providers.
And they could contact you and get involved
Yes.
and get the
Yes.
training and,
Yes.
and help with that
Right.
as well.
The child care centers, we've pretty much hit the
But-
majority of the 45211. I
but-
think there's a few, and there were some things going on that they wanted to wait
But the
so they could join the
family-based
initiative.
providers,
But
yes.
the family-based providers, definitely.
Okay, if you're a provider or you're a parent in the 45211 area and you'd like to get involved, you can contact Carolyn Brinkman at 513-758-1314. That's at 4cforchildren.org. Or you can contact Patty Eber and through the HamiltonCounty.org HCFC. No, that's slash. I don't know. There's some. Just Google it. I mean, it's much easier. Thank you very much for being here. I'm very anxious to see how this proceeds, and we'll have you back in the future. Thank you for making Local 12 Newsmakers a part of your Sunday morning. Join us again next week to meet the men and the women who are shaping and molding our community for a better future. Have a good week.
Going inside the issues of our community, this is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. Looking ahead to the fall election, this is a year that the region's largest city, Cincinnati, will elect a mayor and 9 council members. Normally, I would expect those races to drive the greatest attention. But given the nature of those races and the economic situation, I suspect that the real focus this year will be on a number of levy requests and ballot issues. In Hamilton County, most county-wide levy requests must be formally placed on the ballot by the county commissioners. Since 1996, the commissioners have appointed a tax levy review committee to study proposed levy requests and make recommendations to the commissioners. The tax levy review committee, the TLRC, is composed of 9 members, all Hamilton County residents who have no connection to the agencies that they are reviewing. The committee, chaired this year by Timothy Maloney, the treasurer of Norwood, organized itself in March into 3 subcommittees to examine levy proposals for a health and hospitalization levy, a mental retardation and developmental disabilities levy, and a levy for the Cincinnati Museum Center. The committee filed its report and recommendations last week on July the 21st with the commission, and those recommendations will be discussed tomorrow on Monday, and the commissioners are expected to decide the shape of each levy this coming week. I am joined this morning by 2 members of the TLRC. Mark Quarry is the Director of Government Affairs for the Cincinnati Area Board of Realtors. Mr. Quarry chaired the subcommittee studying the mental retardation and developmental disabilities proposal. And Tom Cooney is an accountant by background and the founding partner and president of Cooney, Faulkner and Stevens, LLC. Mr. Cooney chaired the subcommittee that examined the request for the Cincinnati Museum Center. Welcome to Newsmakers.
Good morning.
Tom, let's begin. How much did the current economic situation factor into the work of the committee this year? And I'm thinking particularly about a couple of the requests which deal with social services, where need is really up, but the tax base is down because real estate values are falling. How much of that influenced, colored, set the tone for things that you did?
Well, I think it helped set the tone, because what we're supposed to do as a committee is balance, the needs of the agencies with the ability of the taxpayers and the burden on them. And in this economic environment, you have to be more cognizant, I think, of that burden.
And is part of your responsibility to advise the agencies that are asking for tax dollars about, or remind them, I don't know what the right term here is, how difficult it's going to be to pass things this year, and that some of your decisions being, this is what we think you'll be able to maybe pass if you make a good case?
Technically, we don't really look at whether or not the levy can pass, but part of the process is that hopefully the taxpayers that that vote on this will know that they've been through a pretty rigorous process that we've looked at and made the best recommendation that we could come up with.
Let's take a look at the process. And Mark, you were chair of the subcommittee for mental retardation developmental disabilities. Take us through that process. I presume it starts with the agency making a proposal about what they think they would like. Is that correct? And then where do you go with that?
Yes, the agency, and in this case MRDD, a lot of times they'll come in and make an initial presentation just to familiarize the committee with the job that they do and the services they provide. Oftentimes after that, and it's the case with MRDD, we will be invited to take a tour of their facility or even facilities. In this case, there are several different places where you can tour with MRDD. And then the process, of course, involves hiring a consultant, an outside consultant to look at the agency.
What kind of consultant do you look at? Are you looking for financial analysis? Or are you looking at an agency that can look at other questions as well? What kind of outside consultant do you hire?
It's a little bit of both.
Right. Well, this, for instance, in the Museum Center, which I chaired that subcommittee this year, we actually hired two different consultants. We hired one that was more of an operational review that looks at the efficiency and compares the museum to other museums. And then because their initial proposal was a very large capital renovation, we actually hired an architecture firm to look at that plan specifically. Okay,
so it really depends on the shape of the request and the shape and the nature of the agency about what kind of outside resources you need.
That's right. The goal, I think, is to see that whatever resources they're looking for from the taxpayers, that it makes sense for them to use it, and that there aren't other ways that they can get those revenues.
Yeah, I found it interesting that reading on the website of the Hamilton County that part of the charge is to find ways to help these agencies be creative, innovative, and efficient. I mean, I found the use of creative and innovative very interesting words here. So it's not just looking at the books, but really trying to look at a very broad approach.
Yeah, and I think what you're seeing there then too is through the process, I think over the last few years, and Tom's been on the committee for a number of years too. Really, the message is going forth then to the agencies that get the taxpayer funding to become more efficient and creative and some of the other things. But I think also it's certainly educating the public, and we hope also in turn sometimes that it's going to be educating the different elected officials who make the decisions that they do, because just like Tom mentioned, it's certainly a balance for the need for the services against the property owner's ability to pay.
Now, we have a full screen here that shows people sort of the bottom number, and if we take a look at this with MRDD, your recommendation, this is for a 5-year levy, is $400 million plus. How did that relate to what the original request was?
Well, the original request or the wish a lot of times of the agency is not necessarily the recommendation that gets made. The MRDD recommendation is going to be the $400 million number over 5 years, and that is in line with the inflation policy, not to increase or not to
go faster than the
rate of inflation, right?
Okay.
And that's a Board of County Commissioners set policy, and that's certainly something we always look at. So the MRDD has done a very good job over the number of years, and they have actually an $11 million carryover from the current levy period. So when the voters hear that this coming fall, they certainly will be able to weigh that with whether or not they should continue to approve their levy.
And your recommendation is for that $400 million plus, but then to use that $11 million carryover in these next 5 years.
Correct.
And get back to zero.
Right. The $400 million would be in line with the inflation policy, but yes, we're allowing them to use the $11 million carryover.
Let's take a look at those numbers again, and because the next number up was the Museum Center. Now this is one where there has been a lot of numbers flying around, and I have to make it very clear, I have a huge conflict of interest, and I don't want to get into too many details here, but as I understand it, your committee and the TLRC's recommendation is at 18.8, and that's sort of the lowest of all of that. That's just sort of continuing what they had 5 years ago. Is that correct?
That's right. That is exactly the same amount that they had for the last 5 years. And we actually made two recommendations, or gave the commissioners two choices. One is the $18 million, which is just a continuation of the existing levy. They actually asked for a total of about $38 million, which was a combination of the existing levy and a bond levy that currently exists that's expiring, which was the original bond to do the renovation that was done about 20 years ago. We recommended to the commissioners that if they believe that the inflation policy that we're subject to allows to combine the two levies, that they get the $32 million versus the 18.
But even if they got the $32 million, that's less than they wanted, and it's a lot less than one number that was floated around out there, $120 million.
That's right. They originally came to us and asked for $120 million, but it was a $6 million per year. It was a 20-year levy that they were going to use to fund their entire capital expansion, or capital renovation, I should say. They determined that they couldn't raise all the funds necessary to do that, even if they got the $120 million.
Because there's a lot of private funds necessary too.
Right, and part of these funds go to fund their operations, and they aren't independent yet, so they still need the operations funding.
And this sort of balancing of all these, the requests, the realistic, what brought you to, okay, you've got two recommendations on the table, but as I understand it, sort of recommendation A is the 18.8, is that right? Is that what the committee's really recommending?
That's what we're recommending, because the members of the committee felt that the inflation policy says that it can't be more than 18 plus inflation, which I think was about 22 or 23 million.
Okay, so what are you using, by the way, as an inflation factor, given the economy right now? How do you project inflation for the next 5 years?
Well, we have a very specific formula that we developed, our committee developed a year or two ago. But basically, we look at the prior 5 years and assume that that's a predictor of the next 5. Okay. Just so we're at least using, rolling good numbers. Okay.
The actual name, I think, is Cincinnati Hamilton County.
Yeah.
I can't remember what the name, the rest of it is, but
Bureau of Labor
Statistics is a fallback.
Right, and it's a semi-annual index.
A third levy that is going to be out there this year is what people have known, and we can put that back up again, what people have known as the Drake levy. But Drake no longer is part of this because they're now in a different situation. So even the name is somewhat problematic, Family Services and Treatment. And this is a collection of a whole bunch of different programs, most of which were already funded under the old Drake levy. So this is a huge reduction, as I understand it, over what we would have seen 5 years ago. And so the question really is, now these sorts of organizations, these sorts of programs have to come to the fore and carry this, not Drake Hospital anymore. So there's a political side to this. I know neither of you were on the subcommittee. Any comments about arriving at this? And there was what's in and what's out, and there were a lot of questions, and there's some programs that didn't get in and one new one that did.
Well, like you say, Dan, I mean, neither of us were on the subcommittee, but I think first and foremost, I think we're always keeping in mind the inflation policy. And certainly we're going to look at new services and not rule them out right away. But when it's something new that hasn't been covered previously, I think that's one of the ways we kind of would eliminate things or include things in the levy.
One of the new services, as I understand, the only new service that's in is the Off the Streets program, which we did a segment on this show about 4 or 5 months ago. So that's something we'll come back to during the campaign. I'll do a substantive look at that.
Yeah, and I think the rationalization for adding that as a new service is it's not really a new service. They just haven't previously been funded by the levy, and they lost some of their funding, and this is just a way so that they can maintain their current level.
Okay. One last area I want to get to. The possible levy for a library doesn't have to go through your committee, is that right? But the library asked you to take a look at it. Am I understanding that correctly?
Yeah, actually, I think one of the commissioners asked them to come before our committee, but because they got into this process so late, they can't go through our full process. So we don't have a consultant that we've hired to look at their operations, but we've already listened to their presentation. We're going to have a public hearing, which is part of our process, Monday, and then we'll maybe make a recommendation, but probably not very specific because we don't have enough information about them.
Well, we're out of time. Thank you very much for being here, and we're going to watch this week to see how all this plays out, and then in the fall how the real things play
That's
out.
right.
If you live on the west side in Cheviot or Westwood, you've probably noticed some new billboards. Stay tuned. After the break, we'll explore the campaign to strengthen families in the 45211 zip code.